Hi, welcome to Health Journeys, a podcast about real human experiences in health and medicine. I am your host and healthcare advocate, Maritza Hasty. Health Journeys is all about discussing the diagnosis and treatments of diseases and exploring personal stories in pursuit of overall health and well-being from different points of view. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Hey everyone, welcome to Health Journeys. Have you ever thought about what it's like to work on the front lines during the COVID-19 situation? Every day we hear stories about healthcare providers that are faced with the challenge of treating these patients up front. But do we really know what they go through, and do we really understand the effects on their family? On today's episode, we have Noelle Freer. She is a physical therapist who is actually working on the front lines and is going to share with us her experience and how it has affected her life as well as family members. Hi, Noelle. Welcome to the show.
Hello. Great to be here.
Thank you so much for taking your time to come and be with us today. We certainly do appreciate it. So can you tell us, first of all, a little bit about yourself and how you got into becoming a physical therapist?
Sure. That was 23 years ago. Originally, I was interested in working with sports professionals and athletes, but gradually, as I learned more about the field, was exposed to hospital situations, eventually working in every setting you could work in healthcare. I have, after 23 years, settled into the home care environment. So I'm actually going into people's homes and treating them there in their own environment. And it's been very eye-opening. It's a lot different from when I originally went in, and a different population than who I originally planned to treat. So, but that's life.
Okay. Yeah. So let's focus on how did it come about that you were, whether it was selected or did you volunteer? How did it come about that you were involved with the COVID-19 situation and those patients?
Sure. Okay. Well, working in what we call a level 2 hospital in Northern California, in a town of about 100,000 people, not actually a metropolitan area, large area like the hot spots that you spoke of on the media. We, as in our hospital, were the only hospital within our city that provided care for anybody. So if anybody gets sick, anyone comes to our hospital, any doctor that refers to therapies, we're going to see them. So people don't actually have a choice to go to different hospitals. If you work for our hospital in Low Medical Center, you will end up seeing anyone that's test positive for COVID in our community. So not really a choice there.
Mm-hmm. Mm-hmm. So you went from home health care to, did you somehow get drafted to come into the hospital during the pandemic? Is that how it happened, or can you tell us how that came about?
So what happened was some of my colleagues ended up seeing COVID patients in the home care setting. So we all knew that was a very real possibility, and we had to prepare for that. What happened to me personally was our census, our patient caseload began to drop, go lower and lower, to where we were losing work and having to what you call low census. So our hospital wanted to keep us all working, so they offered us to float or transfer to what they call the labor pool. So the labor pool, you could sign up for. You weren't forced to, you weren't drafted, but you had an option. If you wanted to keep working, then you could work in the labor pool, which put you in more close contact with the possibility of treating COVID patients. So you could turn it down and basically not be paid, take low census unpaid, or you could sign up to go to the front lines if you wanted to. Front lines there's a lot of gray area there.
Okay. So can you tell us exactly what your role is with respect to the front lines?
Sure. So my actual role when I went into the labor pool was to work in what they referred to as the COVID tents. So basically, I would think most hospitals across the nation have a screening process before people can enter the emergency room. So when people literally roll up in their cars in the parking lot and get out of their car, they are routed to a tent where I was working. So I would be the first person in contact with them prior to any doctor or any nurse in the emergency room. So what my job was to do was to screen them, basically go through a very standard list of questions to screen whether or not they had been in contact with the COVID, some basic questions about respiratory, breathing, nausea and vomiting that may lend to the fact that they may have COVID symptoms. So at that point, we are to make a decision. Are they possibly COVID positive, or are they not showing COVID symptoms? And then we would route them to the appropriate part of that hospital. So there was
I was just going to say, so was there ever a gray area where you weren't sure with this was the flu or was this COVID? How did you make that determination?
Every single patient, we were not sure. We just had to approach every patient as if they had COVID. We had a nurse. We were required to have a nurse in our tent who was the ultimate person in charge of the screening because of their skill set. So as a physical therapist, I have a certain scope of practice. Nurse would supersede me for making those decisions. So I could default to the nurse if I had any question. But nobody really knows, as you know, until someone actually tests positive. So we had a logarithm to follow. Mm-hmm. And if there was any question at all, we would route them to the COVID area to continue with emergency treatment. But it was quite interesting because people would come out of their cars in an emergency. I mean, there would be, I don't want to go into graphic details, but they would need very emergent care to maybe stop bleeding, to life-saving measures. They would come out of an ambulance, but they'd still have to go through screening before they could go to the ER and be triaged by nurses and doctors. So there's a delay.
That's eye-opening, very eye-opening. So can you describe what the worst case scenario that you saw with a COVID patient that you encountered?
Are you possibly speaking of someone that did have COVID,
yes.
Or maybe the worst diagnosis? Okay.
Let's go there. I actually want to know about both, but let's go with COVID-19. But I'm very fascinated to hear the other as well.
Oh, sure. I just wondered what you were looking for, but the worst one, I can't say that there was any extreme cases, but I will say that after we would screen them and send them to the hospital, we never really knew what happened to them after that. So COVID can definitely go undercover. It could be anything from a cough to nausea and vomiting only. In fact, the last patient that tested positive in our county, so in our county right now, there have been 20 positives. So number 20 occurred, or it was diagnosed this week. I did not see that patient. However, that patient came in with hardly any respiratory symptoms at all. This was described by a local professional that saw them, that was educating our staff before we went to treat them. It was a need-to-know basis, so they protected their privacy. However, what they could tell us was the patient was asymptomatic not a lot of respiratory symptoms, not even short of breath. But when they were given a chest x-ray, their lungs were very severe COVID presentation.
So I think what you're saying is important for our listening audience, because maybe they have this, again, this picture in their mind that these people are coming in severely sick, they can't breathe, but yet, that's not necessarily the case. And I think that's what kind of makes this virus so unique and a little frightening, is that it seems to be presenting in so many different ways and manifesting itself so differently that we really don't know until we drill down to the actual tests.
Sure. And you mentioned the word frightening. That is there's a big spectrum there, because when you think about that scenario that I just spoke of, I would say that after I have been working so closely to it, it has taken away my fear. Once you're on the front lines, there's people much more frontline than me. I don't even want to pretend to be even close to the situation of what those professionals are in, doctors and nurses and anesthesiologists, respiratory therapists. I'm not even treating patient after patient and knowing that I'm in a COVID environment. It's an unknown, possible COVID environment, but we just have to be smart. I don't think we have to be afraid. I think we have to be vigilant. We have to wear proper device. I think we have to do the obvious: wash your hands, don't touch your face, keep your mask on. And we wore gowns and face shields. Under that, I felt very safe. And any person that came into the hospital that day that possibly had COVID, I came in contact with. But our county has still managed to keep very low on the diagnostic numbers. So we're down to just to 20. And so I think people following through with all of the proper precautions has really helped. But I just think we're not passing it to each other. It's highly contagious, but I think if you're just smart and aware and mindful of what your body's doing when you're around people, I think that it's not as frightening as it maybe was meant, or maybe what I thought it was a month ago.
So that's interesting that you give us that perspective that, it's all about following the recommendations, about, being smart, about using your PPE, your mask, and about reducing the numbers and being together. So you're kind of giving us a little bit of a, calm down, just follow the rules and the recommendations, and, things will be okay. Can you tell us, when the story of COVID-19 first started to manifest itself, what was it like in your particular area? When did you all start seeing it, and what was that like?
Okay, that was really interesting. I personally happened to be on a wedding anniversary trip in Monterey. So when I was in Monterey was the exact day that Gavin Newsom called shelter in place. And I remember going into a grocery store, and it was just a regular Safeway in Monterey. We had been out hiking and away from the media, so we were clueless. But they had just called shelter in place, and we walk into this grocery store, I think it was 8 o'clock at night, and everyone was frantic in there. Everyone's lining up to get out of the store because they were closing the doors immediately. So everyone had their shopping carts full. So that kind of got my attention. Something's going on here. So then drove 3 hours home to Chico the following day. And it was a little bit different environment because we are, 3 hours off the beaten path from San Francisco. We're north. And we're an hour and a half, almost 2 hours from Sacramento, which is our nearest metropolitan area. But we kind of, it's almost like we're sitting in a bunker waiting for a bomb to drop. That's kind of what it felt like.
Wow.
We didn't know what was coming. And what is this? It looks horrific. We're watching New York. Are we going to be a hot spot? What does that mean for us? And so our hospital rolled out probably just like everyone else, in that following CDC guidelines, following public health guidelines. A lot of unknowns. Rules changing daily. Masks, no masks. Aerosol precautions, no, it's droplet precautions. So we would just pay attention to whatever emails came out, updates from our CEO, who is excellent and transparent and very excellent communicator, helped to decrease our fears. And pretty soon our hospital responded with a FEMA request to open an entire COVID unit in preparation should we have a number of individuals get sick at the same time. So we had a lot of room for overflow, and it stayed empty and unused. Not one COVID patient has come in to that unit at all. In fact, we're all starting to move back into it and bringing the potential COVID beds out to this week. So it's really calming down.
Yeah. Yeah. So it it was kind of like a peak, and now you're sort of in the valley. Now,
relaxing.
what are your thoughts about we keep hearing that the fall, we're going to have this surge again in the fall, that, people don't get too relaxed because maybe we're seeing some flattening. But, we've had some infectious disease specialists on our show, and there's so much information out there, but, it keeps pointing to the fall. Like, we have to go through this cycle. Any thoughts on what some of the IDs or infectious disease specialists in your hospital are saying, or some of the pulmonologists, about the upcoming flu season now in the fall?
I think there's an increased optimism because, for instance, as an essential care provider, I can now go through drive-through testing and get tested. I just found that out yesterday. I think that increased access to testing it's a game changer. So in the fall, we're going to have more resources. We already have more resources in just 1 month than we did when this all rolled out, when nobody knew who was infected. You could be a silent carrier. So at least we're going to know a little bit more about, am I a vector or am I not a vector? Am I potentially harming somebody by coming into their home and giving them treatment or not? And so that's being available to essential care workers and more people. I don't know the details specifically, but I can look that up. But I'm just saying, in the fall, we're going to have even more of that. It's going to buy us some time. I think watching trends is going to be valuable because clearly it's so new. There's no research. There's no research out there to say if 2 people get in a boat versus 3 people get in a boat, is our risk statistically worse or better? We don't know, but we'll have had a little bit of longitudinal trending to watch rather than just models.
Has your area experienced any issues with shortages of PPE? We keep hearing there's this shortage. And how about your hospital? Did they experience that shortage, and how did they overcome that?
Sure. We had a lot of volunteers step up to help. Community came together, and it was really amazing. We had volunteers making masks, cloth masks, and we actually did hand those cloth masks out in the COVID tents. So lots of people came in without masks, so we were able to hand them out to the public. We even interestingly had a man that insisted that his dog had to have a mask, so his dog got a mask.
Oh. Wow.
But
Dogs are
and he
family
went into the
too?
hospital. I don't know how he got through, but yeah. But actually, we had a local distillery that made Purell, a combination of alcohol and aloe vera. So our hospital's using that. We would not have had that without our local business owners stepping up. We would have had a shortage. I was only allowed to use 1 surgical mask a day. That's what I was allotted. I get a Purell bottle this big once a week. So I'm sure if I ran out, I could probably get more, but that's how I've been rationed. And I am direct hands-on care with elderly, frail patients. So we weren't allowed to have an N95, but just 1 N95. So those are a little more protective than the basic surgical masks. I could show you an example, but So yeah, we were really limited and it was stressful. I remember coming in and knowing that I was going to treat a possible COVID patient that ended up never getting tested, but we all suspected he had it, and I was going to go treat him in his home. And so I was allowed to have an N95 mask, but not everyone could have one. That was, a physical therapist or an occupational therapist. So we were really tightening down and rationing resources at that point.
It's very eye-opening when, you have a smaller community. I'm not saying smaller community, but your numbers are a little bit smaller and this is happening. Imagine, here in these big metropolitan areas, San Francisco and Los Angeles. I mean, it's been a real issue, but as you said, there's been a lot of volunteers, a lot of companies that have stepped up to the plate, and thank goodness for that. But I mean, just the thought of thinking, okay, I have one mask that I'm going to wear all day long, that must be, that's just, it's not normal normally. And I think it's a lot of it is maybe we take things for granted or something. I've been in the healthcare industry myself, and you walk in and there's stacks of these masks. You put one on, you throw it into the soiled linen, and you grab another one, and you just always assume there's always going to be the surplus, right? And then something like this happens. So it's very, very eye-opening, I think, for the entire nation to see that, we need to be better prepared for situations like this. So,
and it was very real that we were going to run out of the Purell. And so what they had prepared was a sandwich bag with a little piece of soap and in a bag. And that was going to be our sanitizer kit for homes. So that's our backup.
Wow. Wow. It's sometimes it's hard to fathom that we're in the US and this is what's going on. It's just, it's hard to comprehend. So amazing. So you had mentioned that did you say there was about 20 cases total? Is that what I heard correctly?
Yeah, that was the number that and again, I can check my facts, but that was the number announced last night.
Okay.
In the media.
Were any of those cases colleagues of yours at all?
No, we haven't had any local healthcare workers. Yeah, no. So we've been safe there. And that is, of course, that we're tested. So who knows? I could have had it. One of my sons could have had it. There was a period of time where my son was sick with respiratory symptoms. And so I did disclose to my patients, look, I feel great. I don't have symptoms, but my son is sick. I want you to know that. Do you still want to invite me into your home? And a lot of people said, it was interesting. People said, yes, I trust you. You're a healthcare worker. You know what to do. And I at that point wasn't totally comfortable going into people's homes knowing I lived with a person that was sick.
So this is actually a perfect segue. I was going to say this is a perfect segue. Yeah, because what I wanted to get at is, okay, so when you were working more in this environment where you're potentially coming in contact with COVID-19, tell me about the family. How did they feel about it? Since you said your son was sick, and what were their thoughts about you going and doing this type of work?
I live with boys, young men, 22 and 19, so they tend to be less dramatic. But
True.
Yeah, I could tell they were watching me. There was concern. It was kind of cute because they were definitely wanting to keep me in check. Not that they needed to. Mom, did you take off your shoes? Mom, go straight to the shower when I would come home. They'd be cleaning off doorknobs, and that's a good way to get your young boys to do chores.
Wow.
They would be involved in disinfecting the house for the first time without me asking. So I wouldn't say there was a fear factor, but they're definitely young men. So, but it made them more vigilant. And there was scared when my son got sick. He said, maybe I've got the COVID. And it was early enough in the season, we kind of, oh, come on, you don't have the COVID. And we look back, we're like, maybe he did have it.
So it raises an interesting question that perhaps at some point in time when there's an antibody test, you can find out if he actually has the antibody for the COVID-19.
Yes, and hopefully, like you said, before the fall. Yeah, absolutely. Yeah, I would love to know. Yeah.
Yeah. There's a lot of people that have gone through that have, they're okay now. And that's a big question for them is like, I wish there was an antibody test so that I would know if I had the antibodies for it. Did you ever have to quarantine yourself at all at home or when you came home, was it just life as normal? Or did you kind of stay to one end side of the house or how did you guys deal with that?
I never did quarantine myself because like I said, my son was sick before all of us. So I thought if there was a chance for it to go through our house, it probably already had. And to be honest, that was very stressful the first week because in my mind, there was absolutely no way to quarantine yourself in my house, in anybody's house. There's no way to quarantine yourself when you live with other people. And the fact, if you think about the COVID being like glitter, so glitter's everywhere, right? You can wear a gown, you can wear a mask, but if you have some glitter you're going to come home with some behind your ear or some in your hair. And so that's when you run straight to the shower, but who knows who touched the doorknob before you had a chance to wipe it up. There's just no way to contain it. And that's what I now we're starting to relax a little bit because it lives on surfaces for lives on plastic for how long? 3 days. And so how many of us bring plastic into our house? It's all over our houses. So I just have a feeling that that's the case with everybody, even probably with elderly people that live independently in their homes. And so I think we just have to be realistic about that. I just don't think it's possible to quarantine. So more stressful in the beginning when we didn't know what was happening, less stressful now that our curve is flattened and that we can take a breath. But not all of these metropolitan areas can relax like that.
Yeah,
so and I really feel for those
the key.
people.
Yeah. Yeah, that when you have these areas that have a lot of population or concentrated population that, there's no choice. You can't get away from each other in a sense, And you brought up a really interesting point about quarantine because that point has been brought up so many times and you said it so clearly. It's practically impossible to quarantine yourself in your home. Where that's your home, you eat, you use the shower, so it's all about being responsible in the manner that you expressed. So, very interesting and really helpful information. As far as extended family, do you have, elderly parents or grandparents or things like that? Do you have extended family members that are a little bit older and how has that affected your relationship and your getting together with them, that type of thing?
Great question. That has been really somewhat sad. My father lives in Orange County near you. My mother lives an hour away in Shasta County. They're both early 70s, very vibrant, healthy people. My dad's working over full time as a veterinarian.
Oh, wow.
But, I haven't been able to see my mom until just this Mother's Day. We finally relaxed a little, but she didn't want to interact. I mean, of course she didn't. She wanted to interact. We didn't interact with each other on Easter. We didn't go up there. So that's been hard on her emotionally. She's felt very isolated. And then the fact there's a dilemma in our home with my son. I told you just before we started airing, graduated as a film major. He's graduating this semester. And he wants to go start his life. He wants to go to LA and he wants to, start a job. He wants to live with his grandfather in Orange County and commute up. He's already looked for rent in LA, was going to rent with a friend who was also doing an internship. that's being canceled. He can't find a place to live, nor can he afford it, nor can he get a job as easily as he once thought 2 months ago. So it's hard for these people, the young kids that are graduating, to start their lives and launch. They're really in a holding pattern. And then again, as you said, extended family, he feels he has to think twice about going to live with his grandfather. So that's the big question, is when do we start reintegrating with our loved ones? I actually treated a homeless woman yesterday. I went into a house where they're providing shelter for her, but she's been in 2 homeless shelters this year. And she was very depressed. Her alcoholism has gotten worse. A lot of downward spirals in her health have occurred because she has been drinking more. She's very depressed about being quarantined. She was just lamenting about the fact, when is our country going to open up? It's causing a lot of despair, and it's causing a lot of people. There's more suicides, more alcoholism, drug use is up. So it's really affecting the living as well, the people that don't have COVID. And so that's where it's tough with the shutdown. When do we start integrating with our families? When do we start integrating socially? Bringing the spirits up so we can stay buoyed.
Absolutely. And I think the other thing is as the getting over also the psychological aspect of it, and the potential, the guilt, because you think, well, if I get together with somebody and then the next thing I have a dear friend who's severely immunocompromised. And she and I have always had this, like a monthly lunch together. Well, I haven't seen her forever, and I'm afraid to, because, and maybe you shouldn't use fear, but I just don't want to be responsible, because something happens to her after I meet her, then that's on my conscience. So, it's a tough thing to be. I know my children too, my children pretty much, they kept away from me for the longest time, and we finally broke the seal at one point in time, because, you think, if something happens to me and I didn't even get a chance to, see my kids, and it's the psychological aspect that you bring into the conversation is so important. And I can imagine that when you're coming in contact with people for physical therapy, that now this part of it comes out too. And how do you get them through that?
Yeah. I think the mind-body connection is so powerful. The mind drives our bodies, and when our minds get sick, I see it every day, our bodies give up. And there's frail people in body, but then there's also very frail people in mind. And so, when you hear of quarantine killing people, there's some truth to that. So I just think some good judgment of when enough is enough, when we're being smart enough to slowly start to allow people to come together safely again. That really resonates with me about what you said about your friend, because there's an ethical dilemma there.
Mm-hmm. Exactly.
Exposing yourself and causing harm. Nobody wants that on their conscience.
No, exactly. So things that we don't even, we think about the virus, we think about the physical and all of those things, but when you bring in the psychological aspects of it and the sociological aspects of it, you really bring a whole other dimension to what's going on. But one thing that I have to say about you, Noelle, that I keep hearing is you have a hope. You have this sort of message of hope. You have this message of don't be scared, just be smart, know what's going on. And I love that. I love that you're telling us the facts, but you're also giving us hope. And with that said, what do you think the new normal is going to look like for us? What is our life going to look like? What do you think? What's your opinion about that?
The new normal, I think that what I've learned is, it used to be 2 things that you don't discuss at a cocktail party: religion and politics. Now there's 3 things: religion, politics, and COVID. Don't discuss it because there's such a spectrum of where people fall, on people that save lives, quarantine, and people like this shutdown is killing me. And I think it's very real. It's both perspectives are very real. And I think that we really need to dialogue respectfully. I think we need to sit down and talk about it. I think that we don't need to point fingers and call people names. We need to respect that we're all coming with different lenses. Private business owners are facing homelessness. People trying to open up restaurants. I can't pay my rent next month. How am I going to do it? The money hasn't quite come through. I've been promised and it will, but it's not here right now. So what do I do? So there's that lens. And then we have people that are a little more comfortable. I'm one of them. I'm just lucky I have a job. So I'm not worried about so much paying my mortgage every month. So it's not at the top of my head. Oh, let's open right back up. But I think we need to talk to each other about where can we meet in the middle and be safe. We can't stay in our homes forever. It is going to get better in the spring. You asked about, what is our new normal? It just might rear its ugly head again in the fall, but we'll have more tools. But the important thing is we need to dialogue with each other, both ends of the spectrum. We need to not censor each other. I think that there might be some crazy ideas and some non-scientific ideas, but let's talk about it. Let's just not cut another person off, take down their viewpoints off of the media. Let's get it out there and be smart and research and logically discuss respectfully. So my hope is that we can do that and not be so polarized. But I think that is the way to healing. I think that's the way to finding ourselves back to normal and to realizing this is a new normal. And so what do we do about it? We got to work together instead of fight.
Agreed. Have you ever thought of running for president? Boy, you'd make a great president.
No, no.
But I love
like
your message. I mean, because it's so true. Your message is spot on, and we keep hearing we're in this together, but yet, as you said, it's so polarized as well. And so, when are those words really going to ring true? And I love how you wrap that up. I thought that was great. So,
thank you.
Any last words for our audience, our listening audience, that you'd like to share based on your experience and what you see moving forward?
I just want to say I'm so in awe, amazed, and respecting those frontline workers that have done way more than I've been exposed to. True heroes, going in there day after day, walking away from their families. That has not been me. It's been scary enough to be me and to come in contact with possible COVID, but to walk in a room where you've been told this person has COVID and to give love and care. Some people had to die alone, and the only person there would have been their healthcare worker. So they're just angels. And I just think it's wonderful that you are doing this piece to honor people like that. That's fantastic.
And don't minimize your role, because I understand the distinction, but you have a very important role in what you're doing, and not only that, providing care at home. So a thank you goes to you as well for your work. And I thank you so much, Noelle, for joining us. And I look forward to our next Health Journeys. Support for this podcast comes from Hasty Storytelling. Hasty Storytelling is a creative agency that specializes in production, brand strategy, and live streaming solutions. For more information, visit us at hastystorytelling.com. Health Journeys is produced by Victoria Bilionis and executive producers Dennis Lovelace and Greg Hasty. Finally, if you're enjoying the show, Please subscribe, tell a friend, and visit us at hastystorytelling.com.